There's a fast and fun way to support the Bismarck Cancer Center.
You can steer your way to the Drive to Survive pre-race party. It's happening Friday, August 18th at the Dakota Speedway from 4 to 6.
You can enjoy food, games, race cars on display, Vivian the pink fire truck, and a lot of more fun events for kids. And the event benefits the Bismarck Cancer Center Foundation. And
joining us now, Dr. John Watkins, a radiation oncologist at Bismarck Cancer Center. Dr. Watkins, thanks for being here, sir.
Thanks for having me.
It's our pleasure.
Happy to have you. And you're here to talk about some of the new technology that's offered at the Bismarck Cancer Center, the HDR skin brachytherapy. What can you tell us about that?
Sure. So brachytherapy is basically just taking your treatment material and placing it close to your target or your tumor area. And it has some advantages because if it's right next to what you want to treat, you can spare the other areas that you don't want to treat nearby. And so as an example, in the skin, if we treat with our normal external beam, you might have, if you're treating something on the nose, you might have the mouth, the eyes to contend with. Whereas if you take an applicator and place it right on the nose, then you can spare all those other structures. They're getting very little, if any, exposure at all. And the real advantage there is then oftentimes you can accelerate the treatments a little bit. And so rather than daily treatments for maybe 6 weeks, you might be able to get it down to 10 treatments twice a week. And so it goes much more quickly, a lot safer, and just as effective. So.
Wow. And how new is this technology, and how common is the technology like this?
Sure. Actually, we're only one of two, us and Roger Maris in the state, that have high-dose rate brachytherapy to my knowledge. And so the technology has actually been around for about 15, 20 years, but we're always exploring to try to find new applications for it, especially serving such a wide geographic area like we do. We have patients that travel 150, 200 miles each way for every treatment, so we're always trying to think about ways to get the treatments done not only as effectively as possible and as safely as possible, but as conveniently as possible. And so the high-dose rate brachytherapy for skin has been around for, I think, 10 to 15 years, and it's demonstrated very good safety and effectiveness. And so we're fortunate to have that capability now to offer.
Yeah.
What else should people know about the Bismarck Cancer Center? Obviously, a lot of people know someone who's been there or who have been there themselves. Sure. What else would you like to people to know just about what you offer?
Sure. And I've over, I guess, 16 years now of practice, practiced in 6 states and over 15 clinics. And I tell people that the Cancer Center is really a very unique community supported type of cancer center. I mean, you mentioned the Drive to Survive. Our foundation is very active, and a lot of those fundraisers are from former patients or folks in the community that know somebody who had cancer, like you mentioned. And all the money that we raise from those, whether it's Apple Fest or Drive to Survive, Bucks for Bras, all of those go back to support patient services. So we have apartments in the neighborhood for patients who maybe can't afford or don't have transportation or don't want to drive back and forth, you know, from Glendive or Beach or wherever. But also we have nutritionists, massage therapists, psychosocial counseling. We have a lot of things all in-house at a single place. And so it's pretty special for a community-supported cancer center.
And to get back to the brachytherapy, who qualifies for treatment like this?
Sure.
And is it something that their insurance has to do, or how does that work?
No, it's considered a standard accepted course of treatment. Typically, for skin cancer specifically, there are certain areas of the body that lend itself to it. And so in terms of advantages for treatment, face is certainly one that we worry about. You know, the mouth, the eyes, the ears, the nose. A lot of times surgical therapy may lead to a change in the way that your facial appearance looks. And obviously for you guys being in television, but all of us, we identify ourselves by how we present ourselves to the world. And so anything we can do to preserve that. And so if a plastic surgeon or a dermatologist looks and says, you know, I don't think this is going to have a great cosmetic outcome, a lot of those patients end up in us. Or if they're high risk medically for bleeding or some other complication, then those are the patients that oftentimes will treat with a brachytherapy or other approach if it's appropriate.
Talking about skin cancer, what kind of sun safety tips do you have for people? I know we still have some summer left.
Sure.
And some sun to go. So what do you tell people about protecting themselves?
Yeah, I mean, honestly, just the basics. Try to wear an SPF 50 or higher. Try to limit your time in the sun, and if you do, use some sun shading if you can. And if you're going to be out for an extended period with no real opportunity for shade or protection, then make sure you're reapplying it. Particularly if you're out, you know, on the lake or the river or sweating, you want to reapply every hour or two.
Did you say SPF 50? 50?
That's my recommendation.
Yeah.
North Dakotans live a long time.
My wife is right, and okay.
Got to play the long game.
Anything else you want our viewers to know either about the Bismarck Cancer Center, brachytherapy?
No, and actually in watching your section on the roller coaster day, it reminded me that today is National Medical Dosimetrist Day. So to Carissa, Charity, and Spencer, happy Dosimetrist Day.
Oh,
Okay, what's a
that's
dosimetrist?
awesome.
A medical dosimetrist does all the work in the background to make me look awesome.
Okay,
Yeah.
fair enough.
We've got some of those people here too.
They do all the hard work in the background to design the plans, and so I may say I want this tumor to get a certain amount of dose, but I don't want the heart or the lung or the esophagus or the spinal cord to get a certain dose, and then poof, magic happens, and that's the medical dosimetrist work.
Wow.
Those are important people. Awesome.
Dr.
And
Watkins.
Thank
sorry.
you.
Oh,
thank you so much.
Thanks for having
Thank
me.
you, sir. And for more information, you can go to BismarckCancerCenter.com.
And don't forget to check out the Drive to Survive pre-race party. It's happening Friday, August 18th at the Dakota Speedway from 4 to 6 p.m.
But keep it